The diagnosis took a sort of about 8-9 months, or it may have developed while people were diagnosing irritable bowel syndrome or stomach problems. So that took a while. So I had a sort of a number of procedures, a sigmoidoscopy, and then followed up by blood tests, and then a colonoscopy. And it was during that process, I think the registrar who was doing it suspected that there was some things, saw growth, sent off for more tests, and then sort of that whole process, although I've sort of mentioned it in about a minute, took about 9 months to finally get a sort of diagnosis. But once that was confirmed, everything moved very, very rapidly in terms of setting up sessions with the consultants, the oncologists, setting up chemotherapy, which I had sort of pre-surgery, so chemo and radiotherapy. So all of that was very, very quick. I think I was diagnosed in May and had surgery in August.
Was it a shock?
It was, because I think when the GP and the consultants were saying it's not cancer, we think it's irritable bowel syndrome, you just push it from your mind and say, great, it's not cancer. I think if I'd been rational, if it'd been somebody else in the family, I would have been more rational and gone through a checklist and said, no, we need confirmation, we need to sort things out. So I think there was shock and fear, and that sort of led me to sort of say, thank God it's not cancer, let's move on with other treatments or other sort of examinations to try and get another diagnosis. But once the cancer was confirmed, I think by that time I was sort of fairly convinced that we're going down the cancer route, and having had experience, sort of when the consultant called me in, there was a stoma nurse in the room, so I mean, that was a sort of, the consultant didn't have to say anything. I thought, stoma nurse, yeah, there's a good chance that it is cancer. So no, there wasn't a shock once the diagnosis started. I think the whole point was to try and get better, and try and help the medical staff help me get better. So it was, okay, what can I do? What kind of diet do I need to have? What kind of medication? Just, the end point is more important in terms of getting better.